For weeks, the number of coronavirus cases in children soared 90% in the U.S. The American Academy of Pediatrics reports almost 180,000 new cases in kids between July 9th and August 6th, based on data from states. More than 380,000 COVID-19 cases in children have been reported in this country since the pandemic began. Senior medical correspondent Dr. Tara Narula joins us now. Tara, good morning. What does the data say about how the virus affects kids?
Well, Anthony, parents are really struggling with what to do, particularly when it comes to schools. And so we need to give them a realistic understanding of what the data and the science says. And for now, the understanding is that overwhelmingly, kids tend to be affected less severely. There are low rates of hospitalization for kids. And when you look at the states and New York City that have reported mortality data, kids have accounted for about 0 to 0.4% of the COVID deaths in those that reported. Now, it's important to say that when we hear words like kids are immune, those words matter, and words like immune are misleading and inaccurate when you think about the fact that 9% of all the COVID cases in this country are in kids, that kids have been hospitalized, and the 86 children that have died. To hear those words that kids are immune is extremely disheartening for those parents that have suffered those losses.
Tara, what's behind this recent surge in cases in kids?
Well, certainly, Anthony, we're doing a lot more testing now than we were in the beginning. So we are going to pick up on more kids. We're now testing not just the sickest of the sick, we're testing kids who may be mildly symptomatic. But also the data is really generated from the states. And so it depends on how the states are reporting the data, what they're releasing publicly, what format they're reporting that data in. And even how they classify child cases varies from state to state. Some states say it's 0 to 14, other states say it's 0 to 24. So we're really getting an emerging but incomplete picture of what this looks like for children in this country.
You mentioned the issue of kids going back to school. It's something millions of parents are confronting right now. What does this tell us about the safety of classrooms?
Well, I think, first of all, there's no question it's polarizing. And we've seen success stories both internationally and even in this country when you look at certain daycare centers and camps. We've also seen failures. But in general, I think that schools can reopen in certain places safely. And I think most public health officials will tell you the priority should be to open schools. But it really depends on three things. First of all, the infection rate, the community transmission rate in that area of the school has to be low. The school itself has to make sure that they're putting into place really strong precautions like having kids in small pods, social distancing, masks, good ventilation, isolation and testing and tracing. And then finally, families really have to look at who their child is. Is their child more vulnerable? Do they have an underlying health condition? Is someone in their family more vulnerable? And then when we talk about teachers too, we need to make sure that we are calling them frontline workers and providing them with things like PPE. But I think it can be done in the right setting, in the right places, but there's not a one-size-fits-all approach for every part of the country.
Dr. Tara Narula, thank you very much.
I love my credit card bill.